Good morning, everyone. Welcome to your training. My name's Scott. I'm going to give you a better introduction here in just a minute, but we are still waiting on about 8 people to join our session. So thank you for being on time. Thank you for being here. What you should see, let me make sure, nope, I'm sharing the wrong screen. What you should now see is instructions for logging in to your training domain. Actually, we just bumped up a couple people, so that's great. We still will wait a few minutes though to get to that magic number. We're looking for about 12 attendees. So while we wait, welcome again, but go ahead and open up a browser, preferably Google Chrome if you can. Go to crediblebeh.com and then you can follow the instructions to log in. If this is your first time logging into the training domain, this will be your temporary password, Cred 2022, capital C and an exclamation point. We had a little confusion over the past couple sessions. Some people have logged in to the production domain, so they have logged into MDVOACI. Some of you might have as well. This is an entirely separate domain. Okay, MDVOACI-TRN is a separate training domain. So if you have been in the other one, the production domain, you will still have to log in with this temporary password into the training domain. And it is very, very important that we're working today in the training domain. So go ahead and try to log in. If you have any issues, reach out to us. In GoToWebinar, you can raise your hand or you can open up the control panel and send us a question. Otherwise, we'll just wait a few minutes here to make sure we get the remaining attendees. Welcome if you're just getting here. We are still just waiting on a few people. Hopefully those of you that are logging in or trying to log in are successful. If you just got here, there are instructions on the screen on how to log in to our training domain. So while we wait just a couple more minutes, let's go ahead and try to get logged in, and I will check back in with you. And no more than 2 minutes. Okay, everyone, it looks like we might be settled in with the number that we're going to be at for today, and I don't want to waste too much time. So thank you again for being here. I'm going to come back to this screen. So if you didn't get a chance to log in, that's okay. We're going to see this again, and we'll really make sure that everybody did get a chance to log in. So welcome once again to your end user training for Volunteers of America Chesapeake. My name is Scott Shuttleworth. I have a colleague in the background, Emily Brown. We'll introduce ourselves in just a minute, but we're both training specialists here, and we're both here to work with you and to make sure that you have a really great understanding, a firm understanding of this system at the end of our training today. I recognize some of the names from yesterday's trainings. A lot of you are new today though, so if you were with me yesterday, bear with us again while you hear some repeated information. Those of you that are just joining us for the first time, I do want to make sure though that you understand the system that we're working with, and including the web conferencing platform here, GoToWebinar. So it is slightly different than Zoom or Teams, and that's why we just take a second to go over it. If at any point you lose it and can't find your control panel, you can click on the little flower icon that's down on your control panel, or on your taskbar rather. That's what will bring it back to the front. And that's when you'll be able to see your little control panel here, this little rectangle, this gray rectangle. If you click on the white arrow with the orange background, it will open up your audio options. Underneath the arrow, you'll have your mute and unmute button. Right now, we're all muted on this end. We can mute you as organizers, and then you can mute and unmute yourself. There is also a raise your hand feature that we'll use to check in every once in a while. In terms of the control panel or the audio options, if you have any trouble at all hearing, or maybe your audio goes out, maybe you have issues, it does happen every once in a while in GoToWebinar, just toggle between your little buttons, computer audio, phone call, or no audio, and that will typically fix those audio issues. If worse comes to worse though, you can just log out and log back in. The other thing you might be able to toggle, if you have different microphones or different speakers attached, you can open up those drop downs if you have those and toggle between your different audio settings. Let's take a second though. I'm going to unmute you all on this end. So if your microphone does turn green, just make sure that it turns back red. If it didn't turn green and you want to take a second to make sure that it does work, go for it. That's totally fine. On top of that, if you wouldn't mind, again, some of you were here yesterday, so you know how to do this, but if you wouldn't mind indulging me one more time, finding that raise your hand feature in GoToWebinar and putting your hand up and leaving it up for just a minute so I can see them all go up, so I know that you know how to use them. Because like I said, I will use this to check in and make sure that my pacing's good and make sure that we're in the same place, making sure that we're looking at the same thing. So yep, right now I'm seeing half of us. Even if you were with me yesterday, if you wouldn't mind raising your hand up just to make sure that it does work today, because some days GoToWebinar likes to be crazy and not do things, so could vary, but I think we're good. I can put them all down on my end, so I just did that. You should then be free to raise it again at any point. The last thing, guys, to think about with GoToWebinar is this questions box in the chat feature. So the questions box is for you guys to reach out to us as the organizers. The chat box is going to be coming more from us as the organizers directly to you. So the chat box will have a little question mark icon that pops up when we respond with a question. The chat will show up with the little chat bubble that you can see on my screen here. It looks like a little 3 ellipses like somebody's typing. What I'd like you to do, if you wouldn't mind, in the questions box, type something for myself and Emily to read, just to make sure that your questions box works. So in that control panel, find the questions tab where it says enter a question for staff. Go ahead and just give us a good morning, test, just want to make sure this works, whatever you'd like to let us know, just so that you can find that questions box to make sure it works. Awesome. And what's great, I'm going to read through these, but Emily is also taking a chance to respond to you in that questions box. So Charlotte, good morning. Crystal, good morning. Duong, good morning. Hello again. Lynn, thank you so much. We're halfway through the week. Hope you have a fantastic day as well. Michelle, thank you. Elizabeth, thank you. Great. Perfect. Thanks, guys. If anybody needs any help with that, I think we're good, all except 2 there. But if you have any issues, definitely let us know. And thank you, Emily, for responding there. Okay, we should be good with GoToWebinar. Let's just make sure we're on the same page here with our agenda. We're gonna just get some brief introductions and expectations, just to make sure we're all on the same page and we kind of know who one another are. We'll spend a little bit more time in the PowerPoint reviewing core concepts and terms, things that you need to know before you actually get into the system itself. And then when we get into the system, those last 2 bullet points there, we're actually going to be learning some fundamentals of managing records. We're going to touch just a little bit on that in this session, so less than in the other sessions. And then we're really going to dive into the medical aspect of this. So we're going to, we'll see some documentation as well, but then we'll also look at diagnosing, adding allergies, meds, looking at orders and how you can send an order or create an order, how you can also create a prescription, send out a prescription. And then I think some of you as nurses, from my understanding with my conversations with Patrice and Geneva, will also need EMR. So we have lots to go through in there. And like I said, we'll spend just we'll touch very briefly on the employee and the client record, and then really focus on more of our med stuff. I also just want to focus very briefly on having a quick introduction here. I'll turn my camera on for a second. I'll spend, let's say, no more than 30 seconds on my introduction this time. And Emily will do the same, and you guys then, if you wouldn't mind doing the same thing. So my name is Scott Shuttleworth. I'm a training specialist here at Qualifax. Yesterday was actually my year anniversary at the company. Prior to this time, I spent 8 years in the educational system, so I have a degree in education, kind of bringing that educational expertise to you guys today. Fun fact for me, I am going to Canada. I'm going to Canada next week, going to Toronto, Niagara Falls, and then a wedding in Buffalo. So lots of time in the Northeast there. So I'd like to let Emily introduce herself as well, my colleague in the back.
Hi everyone, good morning. Thanks for having me. My name is Emily Brown. I am the supervisor of product training. So I am just here to be on the back end and answer any questions that you guys have and assist Scott if he needs any technical help on the back end. I am coming to you from Maryland, and I've been with Credible for a little over 3.5 years. Thanks for having me.
Awesome. Thanks, Em. She actually is on an island, Kent Island. I love that little fact. And I'm out of, where do I live? Arlington. I was going to say Alexandria. I moved recently, so I live in Arlington, Virginia now. So I know that's on the other side of where you guys are, but still close. I still kind of know your area, know where you're at. So go ahead, if you wouldn't mind, it's up to you. If you'd rather unmute, if you want to put it in the questions box and introduce yourself, I would love to get a quick introduction from you guys. Name, your role, and a fun fact. So if you want to use that questions box, they can go in there, and when they come in, Emily can read them out, or if you just want to unmute, feel free to unmute and talk out loud.
Good morning. My name is Lynn Thompson. I am one of the billing specialists at the Hope Center, And my fun fact is I'm happy that it's summertime.
All right. Well, thank you, Lynn. I am too. Yesterday, officially. Longest day of
Yes.
the year. Summer has officially started. Welcome, Lynn. Thank you so much.
All right. Crystal popped into the box and just said that she is the senior data manager and winter is her favorite month. Or season. Oops. I said month too, even though I read that, Crystal. Kevin is a Credible SME.
Uh-oh. Kevin. Oh, Kevin, you're logged in as Valerie.
Oh yeah, I was confused for a moment too.
I think that happened yesterday too. I think Valerie sent her, there were a bunch of Valeries yesterday too. So Kevin, Emily and I can take a break, right? You can take the training for us today. Right, I can hear the sarcasm in those two ha's already. So guys, this is actually, I just want to double check. I want to make sure this is actually a prescriber and medical session. Do we have, because I am seeing a lot of repeats here, do we have any actual med staff on the call today? If you are, let me know. Put it in the questions box or raise your hand. Oh, great.
We have Elizabeth popping in, saying that she is a psychiatric mental health nurse practitioner in DC Hope Center.
Oh, great. Okay.
You have one person at least.
Thank you, Elizabeth. I appreciate that.
And fun fact, traffic was not that bad today.
Oh, good.
That always is a fun fact. I used to drive, so I live on Ken Island, for anybody that's familiar with Ken Island, a little past Annapolis. And I used to drive to Rockville to our office whenever we were in the office. And that was, I mean, awful.
I can't imagine. That's good though. Just as a side note, we don't have to, you don't have to say it now. I don't know actually where your physical address is in DC. So if at any point you guys want to throw that in there, I'm just curious because I'm 2 miles outside of the city and I'm always hopping in and out of there. So I was just curious where you guys are located. We could have just had this whole training in DC. I could have taken a bike over. But thank you for the introductions, guys. I really appreciate that. I'm going to turn my camera off and let you look at the screen, but always nice to know you and get to form a little bit of a bond, I guess, which can be challenging as we're staring at our computer screen. So thank you for indulging us in that and getting to know us and you a little bit more. Some expectations here. What are we going to look at as we get into the software? You'll see some live demonstration. You'll get some hands-on practice. So that means that I'll be clicking along and you can click with me. We'll give you time to experiment. We'll give you time to go and do what I just did. So those are the two top pieces there. But just keep in mind that what we're looking at today is functionality. And that functionality is going to be based on Credible's best practice workflows. I know a little bit about you guys. I've had some conversations with Geneva and Patrice, so I know little bits and pieces about your inner workings and your agency. But generally, what we're going to be looking at is functionality. And then you guys, you'll still have some internal training that will be completed by some of your SMEs and some of your kind of internal training teams or project team to go through more of the workflow about how the function then relates to your agency or your role specific function there at VOA. The one thing I always like to point out on the screen too is that you might have to toggle a bit. So just as a reminder one more time, you will have to, once we log in, you might be clicking around in your domain, and then you might need to go to your taskbar and click on Go to Webinar, and then pull up the shared screen and watch what I'm doing again. So if you don't have two screens, multiple screens, you will have to toggle back and forth between those two. Just as an FYI, just to point that out. So if you did need time to, if you needed more time to do something, to toggle, or if you needed to see something again, please, please, please don't hesitate to reach out and say, hey, where were you? How'd you get there? What is going on? I definitely want to make sure that you're in it with us and feeling good and feeling successful, which brings me to this slide here. We want to feel like this woman at the top of the mountain as much as possible by the end of our training. In order to do that, one of the best ways to feel that success, or one of the best ways to feel that success is to have a positive outlook, to come into this training ready to absorb information, ready to practice, ready to master what you can, and ask questions when you run into hiccups and issues, right? Success doesn't always mean that it's going to be happening right away, that you're going to get it on the first try even, but we're here to support you, and the more that you can support yourself by being positive, by having that outlook of I'm going to get this, I'm going to do it, even if there's hiccups, I'm going to ask my questions, the more likely you're going to feel successful in this and feel like this woman at the top of the mountain. We know the software works. We're here. There can be hiccups, of course, but we need you to believe that it does as well, and we're going to get you to that point here. You might not be a black belt master necessarily by the end of the 3 hours, but we want you to feel as comfortable and confident as possible leaving this training today. So that leads me to some important concepts, things that you want to know before we actually dive into the system. That first idea is, or that first concept is teams, and teams are what drive access to view client charts. Specifically, it's a shared team between the employee and the client that drives that and creates that access. So if I'm on, so what is you have a DC MAT team, that might be one of your programs. I'm messing up your teams and your programs. But let's say that is a team. If I needed to view a client on the DC MAT team, I would also have to be on the DC MAT team, right? The examples on the right-hand side of the screen on the screenshot there, if I wanted to view somebody in the intake team, a client on the intake team, I would also need to be on the intake team. There are some profile codes, some higher level security rights that allow you to bypass that. However, most of us as employees will need to have that shared team to have access to a chart. All employees and all clients will be on at least one team, but you can be, both employees and clients can be on multiple teams, up to every team in the agency. The teams and programs that you'll see next are housed in the client and employee profile, like in the screenshot here. Programs are the next, or is the next term, and what programs do are they allow staff to schedule and complete services for a client, and specifically, just like teams, it's a shared program that allows for the scheduling of and the completion of that particular service. So for example, if again, I'm going to use DC MAT, if your med management note or service or evaluation, whatever it might be, that service is part of the DC MAT program. If I need to provide that particular service, then I need to be on the DC MAT program, and my client needs to be on the DC MAT program so that I can then provide that evaluation or provide that injection, provide whatever that is. Whatever service it is. So think about programs too as a collection of services that are specific to that program. Some services might overlap and be in multiple programs, but some services might be very specific to a program. again, is that shared relationship between client and employee that creates that access. And just like Teams, like I mentioned, programs are listed in the client and the employee profile here in the screenshot. Just to drive this home, bringing it all together, takeaways are that Teams drive access and security, specifically a shared team. Programs drive access to services, again, specifically a shared program. This screenshot on the left-hand side is just a larger screenshot of what a client record looks like. We'll see that more in depth when we get in the software. And then on the right-hand side, this service type dropdown. If you're scheduling for yourself, at any point, you'll know or want to know that all of the services that you can provide based on the programs you're in and based on the programs your client are in will show up in this service type dropdown. So I always like to point out the program abbreviation here, those first couple letters, those are really important to recognize, because if you have a service that crosses multiple programs, like maybe an individual therapy or a discharge, you'll want to just make sure that you're referencing your program abbreviations first. I've been using the word services a lot, and that's a pretty common term, right? But just within Credible, we want to make sure we understand what that means in our context. So services are what actually create access to your forms or to your documentation. So if I'm completing an individual therapy session, if I'm completing an individual therapy service, that service is attached to our best practice progress note. The example on the screenshot is group therapy. If I'm completing a group therapy service, that group therapy service is attached to the group progress note. So services are attached to forms that then allow you to document. The other thing that's important to understand within Credible is that all client-related, all client-facing activity, both billable and non-billable, is considered a service. So all of those billable services that you do, again, the med management, actually, I think that's a billable service, forgive me. But any of maybe your injections, anything like assessments, evaluations, all of those billable services are services, of course, but then anything non-billable, like maybe just a follow-up note or a contact note or a release of information, consent to treat, all of those typically non-billable services, we still consider a service. Everything kind of all-encompassing that's client-facing and client-related is considered a service within Credible. All of that then gets housed within an episode for that client. So episodes, of course, are measuring a time period of care within a particular program. So it starts with admission, ends with discharge, and what that's going to do is capture everything, including all of those services we were just talking about that happen within that period of care. So from admission to discharge, your episode is capturing all data that happens for that client. As soon as a program gets assigned an episode, or the system will automatically open an episode for that program. As soon as the program becomes unassigned and they're discharged from that program, the system will automatically close that episode. You can manually update episode information if you need to. Just know that for every program that a client is in, they will have a corresponding episode. We have a couple key resources, key terms that you'll want to remember in terms of resources. On the Credible end, we have our learning management system, our LMS, and our knowledge base, and I'll show you that at the end of our session today. But this is also just a good reminder to ask your colleagues. You have a Credible SME in this session. You have supervisors. You'll have 2 EHR administrators once they go through their training. So all that to say, you have a great support system around you. So use the Credible knowledge base, use your peers, use your colleagues to tie that all the way back to that success slide, to be successful, to ask the questions when you're stuck, because somebody might know something that you don't, and then you might be able to provide information to somebody that maybe they're struggling with. So rely on each other, lean on each other, and I'm positive that you guys are going to be successful here. With all that said, does anybody have any questions, or what questions do you have about any of that key terminology up to this point?
We are clear in the question box, Scott.
All right. All right, yeah. Yesterday's group was kind of quiet too, so if you need anything, don't hesitate, don't be afraid. I'll assume that you're good. If not, but we're here for you, so definitely don't hesitate. If you haven't figured it out, we like pictures here, we like analogies at Credible. This is one of my favorites, because we're about to hop into your training domain, and your training domain is very much like a sandbox. That's why we have this picture here. So you can dig into your sandbox, you can dig into your training domain, you can build it up, you can kick it down, you can do pretty much whatever you'd like within there. And the good news is that it's not going to affect anything in your production domain. Your training domains are copy over, an exact copy over of your training domain. It's a snapshot of your production domain at a given time. So it was copied over late last week. So whatever information was in your production domain at that time got copied over, and now we have a snapshot of that instance. So you will see relevant data. You will see actual clients. You will see those clients that they might have a diagnosis on file already. They might have allergies. They might have some stuff in their profile that's relevant. But the good news is that you can play around with all of that and not be afraid, because the 2 systems, the training and the production domain, do not communicate. So if you want to change their diagnosis, if you want to change their address, if you want to change their name entirely and put in a crazy date of birth and whatever, put in 12 allergies, do that and experiment with it. Get your hands dirty, build up the system, do what you need to feel comfortable, and don't be afraid, because you're not going to affect anything as long as you're in the training domain, because they don't communicate. With all that said, you might see some things that aren't finished yet. You guys you're not quite at go live. So there are some things that are still under construction. And so when the copy over happened, we're getting that domain as it was at that time. So there might still be forms under construction. There might still be some configurations that haven't happened yet. If you see things like that, let us know, of course, and we'll make note of it and make sure that it gets handled. Either somebody already knows that it's there and it just hasn't been copied into the training domain, or you might have found something that we didn't know about, and we definitely need to get that information out. So don't be afraid to let us know if you see something a little crazy or off. All right, I think most of us did this at the very beginning, but if anybody didn't get a chance, come on back in case you zoned out for a minute, especially if you heard that information yesterday. And let's make sure that you are logged in to the training domain. So Google Chrome is preferred if you can, but you could of course use any other browser. You'll go to crediblebh.com, and then you'll follow the login instructions on the screen. First initial last name. If this is your first time logging into the training domain, passwords on the screen. It will prompt you to change your password to something you'll remember. And that domain is critical. MD for Maryland, VOACI, Volunteers of America, Chesapeake Incorporated, and TRN for training. Very, very, very important you get the TRN at the end. We don't want anybody practicing in the production domain. Just in case, I'm going to type the temporary password and the domain into the chat in case you just wanted to copy and paste. Let me know by a raise of hand. Yeah, that'll be the quickest way. Go ahead and raise your hand and go to webinar when you are looking at your home page or looking at the training domain in some way. Got 9 people in here looking for 9 hands. Definitely want to make sure that you're there. So if you once you put it up, go ahead and leave it up. So we definitely want to make sure you got this. All right, we're up to 4 hands. Thank you. If you need any help, please don't hesitate to ask. If you're having any weird errors or issues, that's why we have 2 of us here to be able to help out. All right, we got 4 hands. Just waiting here to make sure. I definitely want to make sure that you guys are in the training domain. So Constance, Crystal, Duong, Lynn, Valerie, I don't know if that's real Valerie or who was it? Emily, do you remember who that was?
Kevin.
Kevin, thank you. Thank you, Kevin. Let us know, or if you need to put something in the questions box, if you can't find your hand, just waiting on those 5 people. I want to make sure that you guys are logged in and good and aren't having any issues. Okay. Duong said he's good. Thank you. Okay. That's good to know too. Don't hesitate to let me know that. Constance said she's driving but was able to log in yesterday, so I appreciate that. That lets me know kind of where you're at. So thank you for letting me know that. Don't be afraid to tell me those things. I get it. We all have other things going on. Then it lets me know where you're at, so I don't have to worry. Otherwise, I would be worried about you. So be safe in the car too. Hannah, I just saw that you hopped in, so I saw you yesterday too. I'm going to unmute you though, just in case you need to unmute. Valerie did the same for you. So just make sure you mute yourselves back up, guys, just in case you would need to unmute at any point. And then I think we should be good to hop in to the software. All right, guys. Quick overview here of our home tab. And then we'll look at the employee information very quickly as well. Home tab here is where you're always directed when you first log in. You have, I say tab because all of those little things across the top are tabs. So you have your home, client, employee, schedule, and service that almost everybody should see. After that, depending on your profile code, you may or may not see the other tabs that I have: admin, billing, reports, and forms. and that is okay. Most of us don't need to be on the billing tab. Most of us don't need the admin or the forms tab. You can breathe easy. You don't have to worry about any of that background stuff. That is based on profile code, and you'll see some other things like that throughout the system where I might have things on my screen that you don't have, and that's okay. On the left-hand side of the Home tab, we have some widgets here. We have a quick search, and that quick search is based on last name or ID. We have employee messaging. If you open up that drop-down, you can see there's employees listed at the bottom. You won't see your name unless you were in a training yesterday with me and already turned it on. We'll do that real quick in just a minute. You could also send a message to an entire team here. You can see those teams. We're going to come back to the to-do list items, and we'll add a to-do list item. You can see though on the right-hand side what the to-do list or the overview of the to-do list will look like. That's on my screen. If you haven't been in the system yet, you won't see anything populated for your to-do list just yet. Back on the left-hand side of the screen, I have some incomplete services. So if you're looking at your screen and you don't see that, that's first of all good, because you don't want to have incomplete services. But if you do ever have any, that you will get a widget here with your incomplete services. Everybody should see links. These links have been configured by your project team as links that might be helpful for you, that you might need to access quickly, external links. There is one there that I included, which is my training survey. Don't do it yet, because you haven't been through the full training yet. But at any point you're back in here after the training, feel free and please fill out that training survey when you have a minute, 2 to 3 minutes. Below the links, I have some critical and expiring auths. You may or may not. Just know that if you need or need to see that authorization information, you should have the access to that, and you'll see your critical and expiring auths. Then on the right-hand side is a lot of just overview information. So if you're not seeing anything on your screen and wanted to just double check on mine for a second, I do have a couple things that have popped up here, such as my to-do list for our med staff and our prescribers. You might see some prescription messages and some orders, pending orders that you'll need to attend to. If you're not on that med team or med staff, you might not see these prescription or order overviews. Notification events and scheduled items, those are there for us. Notification events are based on what are called notification triggers. If there's something that happens within the system and there's a trigger that's been configured, and you have been configured as one of the people or a part of the team that needs to get that notification, that will pop up here. And then as you have items put onto your schedule, or you schedule them yourself, you'll get an overview of those scheduled items at the bottom of the right-hand side of the screen. What we're going to do is hop into our employee profile from yesterday. Quick quiz, who remembers how to get there the quickest? Let us know in the questions box. Or even if you weren't here yesterday and you might have figured it out already, there's a one-click way to get to your profile.
Click on your name.
Employee tab.
Ooh, I heard two things. I heard the employee tab and somebody said something else.
Click on your name in the top.
Click on your name on the top. Okay, perfect. Two great answers. So if you said employee tab, you could, and go to my record here on the bottom. That is definitely one way. We always like to show the quickest way to get somewhere though. And it's 2 clicks compared to 1 click. So it's not a huge deal, but the 1-click way to get there is to click on your name in the upper right-hand corner of the screen. Thank you to you both though for responding. I appreciate it. But once you click on your name in the upper right-hand corner, you're going to be brought to your employee record. Give me 1 second, guys. Okay, on your employee record, just a quick overview here on the left-hand side is the navigation bar. We call it the nav bar for short. This is what allows access to different parts of your record. You'll see a nav bar in the employee record, and you'll see a nav bar in the client record. But if you click on the client tab or on the employee tab just once, you won't see that. You'll only actually see it when you're in a record of a client or an employee. In the middle, we have some widgets. Again, we could add a to-do item from our record here. And if we do that, it will actually hyperlink the employee or the client to that to-do item. Your assignments are listed here, so just take a second to look at your programs and look at your teams. Make sure you are actually assigned to a team and a program in your training domain. We definitely want to know if you're not. Any recent services you've completed will be here on the bottom. And then more overview information, just like on the home tab that you can see here on the right-hand side. So let's do just a quick click here into the config link. If you did this yesterday, again, feel free to just work with us. Or if you want to view it again, go ahead. If this is your first time, definitely go into config on the nav bar. What we really want to look at is the 5th checkbox down, where it says Credible Employee Messaging. I mentioned on the Home tab that we do have a Credible Messaging, an internal messaging system, and you do need to have this box checked in order for that messaging to send or even receive messages through the system. So you'll have to check this now and when you get into your production domain later. The other thing that came up was the SIG pad yesterday. So if any of you happen to have a Topaz signature pad at your workstation, you will need to have this box checked so that Credible knows that you have it and it will interface with Credible. Big key point here is the employee messaging checkbox. Other things, other options and settings you can play around with when you come back in and practice in your training domain. What you want to know though is this update button at the bottom is super important. You'll see this everywhere in the system, an update, save, complete, or add button. Nothing auto saves, so definitely make sure you find a button like this at any point. Click update and those settings will then have been saved. Anybody have any issues with that at this point? Or any questions? Pretty quick. Sure, Elizabeth. So we were in our employee record. We clicked our name in the upper right-hand corner. Clicked on the config link. Checked the box, it's the 5th checkbox down across from Credible Employee Messaging. And then at the very bottom, update employee config. That's what's going to turn on your employee messaging. Any other questions? Anything else there? Val, I don't know why. Let me see. There we go.
Okay, I
You're
can
unmuted
talk
on this
now.
end, Val. Yeah, sorry. Can we put a pin in that for just a second?
Absolutely.
Okay, because I definitely want to answer that, but there's one more thing I want to do here first, okay?
No problem.
Perfect. Great. Okay, everybody, looks like we're good with the config. So let's quickly wrap up in our employee record here and go to our signature. This is definitely an important step because you will be doing lots of documentation that will require your signature. You're once again in your employee record, clicked our name in the upper right-hand corner, clicked on signature, and that's what's going to bring up a box here. You should see, if you haven't done it yet, you should see a green button that says capture signature or add signature. I already have mine in here, but you could just click on that green box and add your signature in here. And what this is going to do, once you save it, when you go to complete documentation, it's called sign and submit. When you sign and submit your documentation, as long as your signature has been saved here, it will just automatically pull in and you won't have to sign each piece of documentation every time. I think that was the most successful I have ever talked and signed at the same time. So I just want you all to know that you witnessed something great in that moment. Still looks like a second grader, but usually I can't talk and sign at the same time like that. You can either preview it if you really want to and accept it on the next screen, or you can just accept that and save it. Constance, that's a great point that I was actually, you're just a step ahead of me, which is awesome. Constance said, basically, will the signature carry over into the production domain? It won't. Nothing you do, these two don't communicate. So you will still have to add your signature again in the production domain. You will still have to turn on the employee messaging when you get into the production domain. But good news is that that's why we're training it now, so that way you can do it in the production domain very quickly. Hopefully, I think that answered your question, but if it didn't, Constance, let me know. Does anybody have any other questions about these config options in your employee record? Or any issues, anything I can answer? And then Valerie, if not, I'll answer that question real quick. So Valerie, did you, because I think we're good on this, did you turn on this attachment scanner? Did you check this box? If you're looking at my screen.
I did, yes.
Okay, so that if you have, so if you have a little desktop scanner, like an insurance card scanner, just a little one, you can, that will interface with Credible, but it does just need a plugin.
So the plugin is with the computer or the plugin is with the scanner?
The plugin would be downloaded to the computer so that the scanner then can work with the computer.
Okay, thank you.
You're welcome. Cool. Okay. All right, guys. I just want to point something out. We don't have to necessarily go through them, or we could actually just do it very quickly because I want to make sure we're okay. Just checking my notes here. There is one last thing that I want you to notice or know about work hours on your employee record, because the front desk is planning on using a feature called First Available. And because other people are scheduling for you and they might just want to know what your typical work hours are, there is a work hours link in your employee profile. You have 2 start and end times here. You don't have to use both of them, but you can see the example that I have. You can start at 9 a.m. and go straight to 5 and just have that big chunk. Or if you typically have like a lunchtime that's predefined every day, you can kind of work that in. So let's say you start maybe at 8:30, that says 8:15, 8:30, and go to about noon. And then if your lunch is from noon to 1, you can pick your second start time as 1 o'clock so that you have that hour break in between. And then maybe you go to what, 5. So that's how you would use those 2 start and end times. Why is it important? Again, because if front desk is looking for the first available appointment and you don't have work hours scheduled or put in here, input right here, then first available won't have anything to pull from for you. The system wouldn't have any data, it wouldn't have any times to actually look at. So that's important, number one. The second reason why it's important is that it provides a visual. If you wanted to look on my screen for a second, I didn't save these. If you want to look on my shared screen, it puts this little gray bar on your schedule. And so even if they're not using first available, if somebody else is scheduling for you, that little gray bar will represent your typical work hours. So that way they'll know, hey, don't schedule me before 8:30. I'm not going to be in the office. Or my lunch is usually, again, from 12 to 1. Don't schedule me for that time. Just a quick note about that, but it is important that you have work hours entered into your record here. So config, signature, and work hours. I'm going to click back on the Home tab. I just want to point out, so if you're clicking along with me, go ahead and do that, but I just want to point out here that employee messaging, now that you've turned it on, you should see your name here. If you want to practice with that, feel free. I'm going to kind of skip over the practicing of that for right now because it's pretty easy, pretty straightforward. We also have a great little micro learning video on that. What I will do though is at least talk through the to-do list items because I think those are important. I think they will be very useful for you. So I could quickly, if I wanted to, just type into this text box and click add, and that would add to my to-do list very quickly. But if you click on the detailed to-do list add link, it's going to pull you into this screen where you have the ability to add more detail to your to-do item. Some of you might need to put to-do list items on other people, on other employees' lists. And to do that, you click the little ellipses and you can search for that person. So if I was looking for my colleague, Emily, I could type her name, I'd find her and click the ID number that would pull her in. You will always be defaulted though when you're adding a to-do list item. You can put a target date on here. So if we needed this to be done by tomorrow, you could use the calendar icon and put a target date on that. And the summary is really what the to-do item is. So what are we actually trying to complete here? Finish documentation for client. Okay. Below that, you have options to really define this even more. Priorities, low, normal, high. Percentage complete, if it's a long-term project, where are you at? If you wanted somebody else who's looking at your to-do list to know. Same thing with the status. If it's maybe a longer term item, you might want other people to know, like supervisors, where you're at in that process. And then there are some category colors to also kind of keep these things neat and tidy. Maybe they represent different types of items. I think I don't have a blue on there yet, so I'll put a blue category color. But think of these as virtual sticky notes for you. So hopefully you don't have to put all those little pieces of paper on your desk all the time. You can have all those to-do items, those virtual sticky notes, right within Credible. And when you're ready, of course, you'll want to click the Add To-Do item, and that will add to your to-do list. I mentioned earlier that if you're in a client record or in an employee record and you add a to-do item through their record, their profile will be hyperlinked. So I hyperlinked, or I added a to-do item through Michelle's client record, so it hyperlinked her name, so I can quickly then get to her record here. So I right-clicked on it and opened in a new tab, just so I didn't have to go away from the screen. But that's a nice thing to know about our to-do list. The arrows represent priority. The select button will take you back into edit. And then if you did complete this item, you can click the complete button. If you put it out into a future date, you will need to filter for that future dated item until that date shows it won't, or until that date hits, it won't populate on this list. So you will have to filter. I know that probably felt a little quick to maybe those of you that haven't been in the system before, but I really just want to make sure we are good with the more meatier part of this training. But what questions do you have? Do you need to see anything again about any of that employee config information? Okay, awesome, guys. Just making a note there. I appreciate your patience. So that's going to take us to our client related information. You guys, most of you won't be adding clients in this call, so we're not going to go through that process, but we will. I'll take a second to go to the client tab. And on that client tab is where you have the ability to search for and view client information. Makes sense, right? Very straightforward. If I'm looking for clients, I go to client. If I'm looking for employees, I go to employee. As I'm looking at the client tab, though, across the top is an alphabet. And that alphabet is for a last name search. So if you wanted to click through that alphabet, it's going to pull up a list of all active clients with that letter of their last name. Right? Active or enrolled, I guess, between DC and Maryland. You have kind of two different terms there. All right. Below the alphabet, you have some search and filtering options. The home tab was that quick search. When we go into the client tab, we have much more powerful search. Now we have first name, date of birth, we have the last name. We can search for different statuses that a client might be in. Maybe somebody we're looking for that got disenrolled, or we're not sure if they're still in the system. We can search for those different statuses. And then what I would suggest actually right now is filtering for those of you that didn't create a client yesterday, if you were in the training yesterday. So if you're not seeing any clients, what I would suggest is to filter for a program that you're in and find a client in the program that you're in. So if you're in DC Mat, filter, click that and filter for a program there. Let's see. Valerie, I just saw your hand pop up. Actually, so Valerie, just so you know, Kevin is also logged in as Valerie, so I'll just have to ask each time if you're Valerie or you're Kevin. So
This is the real Valerie. So
Okay.
my question is, what's the difference in the status between disenrolled and discharged?
So I think those are you based out of DC or Maryland?
Maryland.
Okay, I think the discharged is a Maryland status and the disenrolled is a DC status. Anybody DC related? Is anybody DC here? Can you confirm that that's correct? So that's something
We'll
I'm
figure it out. Okay,
vaguely
thanks.
familiar with, but I don't want to speak out of turn with that. So Elizabeth, I see your hand. And Tanika, I see your hand as well. Tanika, I got you unmuted. And actually, Elizabeth, you're unmuted on this end as well, if you wanted to speak up. Uh-oh. Yeah, Tanika, I don't know, you might be having mic issues because I can see you unmuting and muting again, but I can't hear you. Your mic might not be connected. Michelle, I see your hand too, if you wanted to unmute, if you had insight into that real quick. Maybe not. Feel free to put that in the questions box too, guys. I'm fairly certain that's what it is, but we'll double check when you guys have. Yeah, Tanika, you might need to go into your audio tab and choose a different microphone possibly. If you happen to unmute at any point and your mic does work, just shout that out to me. But just if you happen to be looking to Tanika, remember in your audio tab here, you have those different drop downs in case you do have different mics. Okay. To pick back up here, what I need you to do, again, so that you can schedule for and complete some documentation for a client, what I need you to do is filter for any of these programs, any program that you might be on, and find a client or a list of clients that pops up there. So we're all on different programs and teams. I'm not going to do that just for security purposes. Once you do that, though, you should see a list of clients that are in your program. Go ahead and choose any one of them, and you can get into their profile by clicking either their hyperlinked name or clicking the view button. That's going to take you into their record. So just let me know if you're with me, if you're looking at a client record, can you raise your hand and go to webinar, please? I just need to know, or would like to know, that you are set looking at a client record, because we're going to spend just a minute here updating some of this information. For those of you that weren't here with us yesterday, and if you have maybe zoned out for a little bit, that's totally fine, but come back because we're going to be doing some stuff with the client record here that you didn't get a chance to experience yesterday. So if you happen to, like, you know, I don't know if you're playing Candy Crush or whatever, no problem, but definitely come on back and find yourself a client because we are going to be adding more to this client's record than what you did yesterday. So definitely let me know if you need any help with that. I'm going to assume though that we're pretty much okay. Looking at a client, the first couple things will be repetitive, but trust me, they'll go by quick, and then we'll start diving into some stuff that you didn't get a chance to do yesterday. All right. On this client's record here, just a quick overview. On the left-hand side is that nav bar once again. Of course, you will see some different information compared to the employee nav bar. On this side, we have the treatment plan, diagnosis, insurance, teams, programs, families, allergies, orders that we're going to go into, warnings, lots of information that we'll be able to add and access for our client. In the middle, I added a client picture. If you guys don't do that, that's fine. I just wanted to have one in there so you could see what it looks like. To-do item from here are assignments. You guys probably won't be adjusting any assignments, but know that they are all listed here. What you see in bold is a primary assignment. That typically means that that's where they're receiving most of their services, including employees. Looks like Chris doesn't have any primary assigned employees, but all of the employees that are on those teams are listed there still. Episode information is listed here. I could view it if I'd like by clicking in the ID, and then overview information on the right-hand side. We will go through and update some of this information. So the quickest way to do that is by clicking the edit button. And this is where I can edit some of that demographic information. So if I'm in a session with a client and they say, hey, I have a new address, I could update that. So I'm going to update this, not real street, okay? And maybe they updated or maybe they got a cell phone. So you can update whatever you'd like in here. You can see all of that information that is listed that you have the ability to update. I'm going to put a social in for them. Okay, and I'll update the client. I click that update button on the bottom left, and that's what actually saves my information. You can print from here as well. So I can click the print button. I can pull in anything that I'd like that you see here. Visit headers will pull in just kind of a snapshot of the recent visits. No documentation, but just like the service type, the employee, the time, date, all that. And of course, then you could print. Not much to look at for this one right now. Just a quick, easy way to print a face sheet if needed. And then you do have the full client info link here. And what that does is gives you a read-only version of demographic info, some billing info, the assignments are all listed here. The client extended is a portion of the client record where just kind of extra information is housed. So you can see that you have some substance use information in that client extended profile. That client extended profile, in case you didn't see this yesterday either, is listed as a link on the nav bar. All right. What we're going to do here is start to add and beef up this profile. So if you were here in the afternoon session, you saw these two things yesterday. If you were only in the morning session, I don't think you saw this at all yesterday. So we're going to add an external provider and we're going to add a warning. So some of you might have seen this yesterday, but then we're going to add a diagnosis, allergies, meds, med profile. So 2 things that are repeated from yesterday, and then we'll really start getting into a lot of stuff that nobody saw yesterday. So just so that you guys are aware of where we're at, those of you that are repeating sessions. Starting with, let's start with a warning actually. And if you wouldn't mind letting me know, being interactive here for just a second. When we find warnings, the warnings link, it's over on the nav bar, has a little question mark icon, exclamation icon, wow, sorry, it says warnings. These warnings are here for you to add anything that might be pertinent for other employees to know before interacting with a client. So what are some warnings that you guys have run into, or things that you would like to know as important information before you interact with a client? Go ahead and if you want to unmute or put it in the questions box, I'd love to hear from you. Anyone? Okay, so I'm going to just add this warning then. You have the start date that populates as today. Your end date is suggested to not, we suggest to leave that open because you don't necessarily know when this warning will no longer be relevant. So we're gonna not end date this. You have different levels of warnings, low, medium, high, and urgent. As an agency, as a team, as a program, you'll want to decide what actually constitutes each one of those levels, being very, very particular about the urgent level warning and only using that in very few circumstances, because we want that urgent warning to really mean something when it gets placed on a client's record. I'm going to say that this client is prone to violent outbursts. Whatever you might want to use that for, I'm sure you guys have some ideas of these things and you've heard a lot, but however you might decide to use this warning, just know that it does show up in multiple places within the system, and it is meant for things that other employees should know or would want to know before interacting or scheduling this client. When you're ready, you can just click the add warning button, and that will add that warning to this client's record. It is highlighted in the color of that warning. If you needed to edit, you could click the edit button. And then if you go back to their overview, if you click overview or click the hyperlinked name, you'll now see that that warning created a new widget in the profile. It also shows up here as a little, that triangle icon. It's highlighted in the color of the highest level warning. And I can use that, or I could click on that to find a list of all of those active warnings. What questions do you have about warnings? Or do you need to see anything again related to warnings? All right, so let's add an external provider, and then we're going to start hopping into stuff that you have not seen yet. So EXT provider is on the nav bar over here, right below warnings. Looks like a little doctor icon. So go ahead and find external provider. You'll notice that this is split in half. You have a list, you have some functionality above or, and you have some functionality below the or. Patrice and I chatted about this a little bit yesterday, and they're still making some decisions related to the kind of above and below the or. Hannah, I see your hand. What's up?
I don't have the or option.
You don't see below the or?
Yeah, correct. It just has add
Okay.
new client provider and it stops at the provider drop down.
That's okay, and I'll tell you why. Just to finish out that explanation, most agencies won't open up the bottom half of this to everyone because this is where external providers actually get added into the system. So let's say, for example, I'm looking for my provider in the dropdown and I don't see them, so I'm looking for Williams. Or let's say Steven. Steven's a better one. Let's say I'm looking for Steven Geller as the provider. I don't see him. Somehow I skip over him. If you have the bottom half, you could feasibly type in Steve Geller instead of Steven. Somebody else might not see him and type in Dr. Geller here. And then you could feasibly end up with 3 Steven Gellers in the provider dropdown, and it just gets messy. So most agencies will only give the bottom half to certain profile codes that will then be responsible for adding new clients in. Now the other half, let me say this, the other half that Patrice and I talked about yesterday, perfect timing, I just saw Patrice pop in here, is that
Oh, good, because I got a question.
they didn't fully make a decision yet as to the workflow of if you're not seeing a provider in the dropdown and you don't have access to the bottom half, what that workflow looks like. So that is still a kind of to be determined.
Okay.
Valerie, I don't know if that answered your question or if you had a.
Well, now that Patrice is on, I just would like her to make a note. Intake needs that. We in intake will need that to add the providers.
I made that note yesterday.
You're the best. Good morning.
Yes,
Good morning. I can see you really missed me. I literally got on a second ago.
right as I was speaking your name. Crazy timing. For those of you that, most of us though should just be selecting from the type dropdown. The type will then narrow down the provider list. So if I'm looking for family medicine, yep, okay, I have 1 in here, 2 in here. That will narrow down my providers to only family medicine providers. Same thing with, let's do physical therapy. Anything in there for physical therapy? Nope. I'll do 1 more just for fun. No ENTs. Okay. Anyway, that narrows it down. And then you could select from your provider list, and then it is just a quick, simple click of add from list, and that will add that provider to this list. So not only is this helpful to just have a record of external providers, but it also ties in to med lists. So let's say Michael Dury prescribed Chris an antidepressant before Chris got to VOA, and we just want to document that Chris is already on that antidepressant. If I've added Michael Dury, Dr. Dury, to the external care provider list for Chris, then when I go to track that and record that med, I can tie Michael Dury to that med as the person who prescribed it, as an external provider. So that's the other piece of functionality where that ties in. Any questions about those pieces of functionality, warnings or external care providers? Okay. Are you guys, Patrice, I know you just got here, so good timing for you. But I still like to have, even though it's a shorter session, I still like to take at least a quick little break to stand up and just kind of get away from the screen for a minute. If we're cool with a 12-minute break, I know that sounds a little odd, 13 approximately, we could come back at 12:40 and then still have plenty of time to dive into all of the new kind of medical related stuff through the nav bar, and then a little bit of documentation as well. Sound good to everybody?
Sounds great.
10:40, we'll get back, and those of you that have been in multiple sessions, you'll actually get some new stuff in here. So get ready. See you soon. All right, everyone, I am back. A couple extra minutes there. I hope you had a nice little break. Time to step away and stretch. Get your eyes off the screen for just a minute. But we are back here. I navigated away from my client. So what we're going to do is find ourselves back to the client we've been working with. So I've been working with Chris Rhodes. Whoever that client is, if you happen to navigate away from the client tab, that client should now show up on your recent list. So if you didn't hear that yesterday, if you're new to this info, when you initially click on the client tab, the list that shows initially is a list of the recently interacted with clients here. So these are all clients I have kind of clicked into and viewed their record or interacted with. The most recent at the top down to the least recent at the very bottom. So I'm going to go back into Chris. Go ahead and find your way back to your client too. And for those of you that have been in multiple sessions, this is all going to be new information for you. Those of you that are just joining us today, this is all new. So we'll keep moving along here. First thing we're going to look at is diagnosis. So we can diagnose through the nav bar here. Of course, in terms of workflow, where that falls, in terms of how many assessments have been done, where you do this. All right, which point you do this is internal workflows and decisions, but in terms of functionality, that link lives here on the nav bar. So go ahead and find that for your client. Click on diagnosis. And what that does is brings you to this page here where we have the ability to add a new diagnosis. You can click right into that text box across from new, and this will be a search as you type field. So I always end up either going with depression or anxiety. You'll notice you have both ICD-10 and ICD-9s that populate. And you'll notice that, again, it is a search as you type field. So as I type, anything related to exactly what I have typed up to this point will show up. So I started typing with text, but you could also type and search with your actual codes. So if I wanted to go with F33.1, I could do that if I have those memorized off the top of my head, which I'm sure some of you do, using them as frequently as you do. You can do that. This is just a pop-up, Patrice. I think this can be disabled, just as a note. I would check with Fatmata.
Okay.
Yeah, right. I think the ICD-9 little pop-up can be disabled if you don't need it. But if this does pop up here, guys, you can just click save without your ICD-9 because we're diagnosing with ICD-10 anyway. And what that does, once you select from that kind of populated list, that drop down, you have lots of options to enter more information regarding this diagnosis. Who is it diagnosed by? If it's you, of course, you're going to type your name in. If this is a previous diagnosis coming from a different provider, an outside provider, you could put that outside provider's name here, whoever that might be. You have options for diagnosed date. You can use your calendar, or you could free text. Options for onset dates as well. This might maybe started back in, say, a year ago. Okay, this started back in 2021. Resolve date, previous onset date, all of those are here for you to enter information for. This default for programs can be important. Not everybody uses it. It might not be important for every client, but let's say this client is in multiple programs and has multiple diagnoses. If this major depressive disorder is the primary diagnosis that needs to be attached to billing related information for the for psychiatric rehabilitation. Maybe I could select the psychiatric rehabilitation program, and then if there's multiple diagnoses on file, this major depressive disorder diagnosis will be the primary for billing purposes anytime that we do a service in the psychiatric rehabilitation program. If there's a different diagnosis, let's say maybe there's a substance abuse diagnosis that needs to go out, or a if you're a primary care, maybe there's a primary care diagnosis that needs to be defaulted for the primary care program. If they're in multiple programs, that can be helpful, so that way you don't have to always reorder them for those programs later. Michelle, what profile codes can enter diagnosis? I don't know in your system, actually. It is definitely a security matrix, right, Michelle? But I don't know, Patrice, if you know which profile codes you gave access to diagnosis and which you didn't.
I do not, but we can look into that and get an answer.
Okay. Michelle, sorry, I can't be more specific about that, but is there a particular reason? Was there a reasoning behind that, or were you just curious? And Hannah, what client are you trying to?
Mickey Mouse.
Let me see. I just want to make sure he's on. That's because Mickey's not on any programs. So he doesn't have any programs.
Oh, okay.
So I'll assign him to a couple. If you want to go out of the diagnosis link, just go somewhere else in his profile for a second.
Okay.
I'm just gonna put him on a bunch of random ones. Okay, so now if you go back into diagnosis, you should see those. And Constance asks, can you pick multiple programs to default for? Yes, just be careful. I mean, only pick multiple programs if this diagnosis would actually need to be the default for all of those multiple programs that you select. But yes, you could. It's just a matter of holding down Control on your keyboard and clicking multiple programs in that list. I always like to point that out. It can be helpful. Like I said, those maybe not in every situation, but if you have that specific situation where they're in multiple programs and it might need to be a different diagnosis that's primary for those different programs, you could do that. You can see the other options you have to define this diagnosis, but once you have that, actually, let me point this out before we click save. The other way to order your diagnoses is through this drop down here. Right now, most of us are probably only seeing one because there's only one diagnosis so far. But if we click save, if I had multiple diagnoses, they can be reordered here in the order that they should typically be in. But again, if that default can be nice if they randomly for those programs would need to be different. Let me enter. Okay, already have all these in here too. So maybe I'm by no means a doctor, but maybe we needed to add this one, and this post-traumatic headache would need to be defaulted for primary care. And then that one, even though it's secondary, anytime we did a primary care diagnosis or primary care, that would then show up because I defaulted that for the primary care program, even though it will still be in this order every other time. I'll show you too on the sign and submit screen where we could reorder diagnoses as well. So there's lots of ways to make sure we get the correct billing scenario for that. What other questions though do you have about diagnoses? Duong, I see your hand is up if you wanted to unmute.
Yeah. Hi. I have a couple questions
Okay.
on the diagnosis.
Okay.
For primary care, at first, who's entering this information? A provider, or biller, or somebody else?
Well, feasibly, it should be the provider, right? The person, the doctor who is diagnosing. But in terms of how that's working as at an agency level, Patrice, I don't know if you have any more insight into that, because feasibly anybody with the rights within the system can enter that diagnosis, but I can't necessarily speak to what happens at the OA for you guys.
It becomes a function of our process. So the program directors would know the workflow that we currently follow, but you are right as far as permissions, it's profile code based. But it
Right.
depends on who we decide should be doing that.
I'm just trying to see how this is going to flow to the billing side. And because of the primary care claims, their diagnosis, the primary diagnosis changes for each visit. It's not going to be the same. It's just, it depends on what's the reason that the patient come in. So I'm just trying to see that who's entering them and how we gonna, let's say today is 6/22, a patient come in and who's entering this and how it's gonna flow to the billing side. So that's what.
Okay, so we can have an internal meeting where we decide what we want that workflow to look like. I'll email you later.
Okay, all right, that works.
Let me just show you while it's fresh in our minds. Let me just show you the other place where that can happen. So I have this sitting here. We'll go through this documentation later, but all of those diagnoses then, once they're entered, will show up in this dropdown. So if I need to reorder them again at this point, as the clinician, I have the ability, or the provider, to do that here before I sign and submit. So just so that you know that that exists too. So it's not a full stop on the diagnosis link. Once the diagnosis is entered, they can be kind of reordered before it's signed and submitted as well. Any other questions about diagnoses?
I don't have a question, but just internally, when we go through that Duong as well, I can show you with the version that we're using in ICAMS right now, there is a way that we as the billers are able to update the diagnosis code if we need to. So hopefully it can process the same way in this new system. So I can show you how that works. And it should be able to be the same way when we're billing. If we need to change the diagnosis code, we can do it.
Perfect. Good information, guys. All right, let's keep moving along then. Let's go ahead to adding an allergy here. That link is on the client's nav bar. Looks like a little inhaler icon. We can add allergies. Give me 1 second. I don't know why training domain is a little weird there. Okay, back on that nav bar, we see our allergies. There we go. You shouldn't see any just yet, unless you're working with a previous client, maybe that got uploaded already. If there are no reported allergies, you could check this box for reporting purposes. But we are going to add an allergy, so go ahead and click the Add Allergy box. And that's going to bring you to this screen here. And this is going to be another search as you type field. It's really, really important because you guys do have prescribers, you are doing electronic prescribing. It's really important that you select from the drop-down that begins to show up here. So I always start typing penicillin because I am allergic to penicillin. So it's always in my head. But as I begin to type, I'll get results based on what I've typed. And then it is important that I select from this list because the system will automatically do a med allergy interaction check, but only if I have selected the allergy from this dropdown, and only when we go to the meds, when we show adding med, it will only do that check if I've added that allergy and the med selected from the dropdown. So very, very important here to select, and it's a really extensive list. You will be able to find what you're looking for, but just know that med allergy interaction check will take place, but only if selected from the dropdowns. So go ahead and select yourself an allergy. The additional text box is not required. It's there for you if you need it. If there's any, not sure if it's specific, type, or all. Okay, I'm again no medical training, but whatever you might need to note about that, you could. There is a severity. We do need to select a severity and a reaction. So you have from fatal to mild. There's also life-threatening. So you could select the option as needed. And then these reactions are here. It is a very, very long list of SNOMED related codes and reactions. Very, very, very long. I can begin to type though. Maybe respiratory arrest is one of them, is a reaction, okay? I'll select that one. So you don't have to scroll the whole time. I just began, it's not a fully search as you type field like the allergy is, but if you begin to type what you're looking for, it will kind of take you to that area in that list. And then there is a place for reaction notes. Now, if there are multiple reactions to a single allergy, that question comes up a lot. Our suggestion is to put the most severe reaction, record that in the dropdown, and then maybe put the secondary and or tertiary reactions in the notes. Or if they're both equally severe reactions, the other way you could do that is just add the allergy twice, in case you wanted to make sure that both of those very severe reactions are noted separately. There is this med allergy checkbox, which is only for reporting purposes. So keep that in mind. This has no bearing on the med allergy interaction check. When you're ready, you can click Add Allergy. Let's see. Okay. Duong. Let me look for her real quick. Strong just said she didn't see. Yeah. must then be a security matrix thing, Duong, that can be locked down. So it's possible that your profile code isn't allowing you to add an allergy. You're welcome. What other questions do you guys have about allergies? Okay. The last little bit to understand about that, kind of like everything else that we've seen so far, once it gets added to this overall list, you'll see everything, or the overview list, you'll see everything that you entered with your additional comments, all of that information. I could edit if I'd like to edit. The discontinue button is here for us if we'd like to discontinue, because most of you won't have a delete button, and we don't really typically want to delete too much out of our EHR anyway. We would just discontinue if that allergy is no longer relevant. Okay, if you guys are good, then let's check out the medical profile, and then we're going to spend a good amount of time in orders. Okay. So finding that medical profile, that's 2 below allergy on the nav bar. And your med profile is here for you once you click on that link. You have your height and your weight that you can enter, check-in notes, vision, hearing, mobility. You have this, actually haven't seen this. This might be specific to you guys and your domain. General state of health, last hospitalization, last injury. And then you have the med conditions down here at the very bottom. So if you're clicking along with me, go ahead and fill this out, or if you're just watching, keep watching and taking notes, but I'm going to put in height and weight here. The BMI will calculate automatically after we've saved this. So you can add your check-in notes for this visit. You can select your vision, hearing, mobility. Thinking that this is our first visit, most of this will stick from visit to visit after we've added it, but let's say it's normal without correction. Hearing is impaired, maybe, and mobility, I'll say walks independently. You have a general state of health drop down that you could select. Excellent, with a text box to add additional comments needed. Last hospitalization, last injury, you could add dates for those. You could add extra information regarding that last hospitalization, my apologies, and last injury. And then you have these med conditions at the bottom. Med conditions can be self for the actual client. You could also document whether or not this med condition is for a family member. So I'm going to document here just something, maybe Lyme disease. When you check a box, you'll get this little pop-up where you have the ability to record the age of onset. It's listed by number, but also kind of generalized age ranges as well, birth, teens 30s if they're not 100% sure. And you could add extra notes here as well, as needed. Like everything else, we'll want to click our update button. That then populates into this information here, okay, for our age of onset and our notes. If this is, if we're documenting a condition, a family-related condition, maybe mom or dad has diabetes, or you know, there's a history of cancer in the family. We in this session didn't go through adding family members because I think have our med staff, from my understanding in my conversations, won't do that. They'll have already been entered. But family members are entered through the nav bar. Once family members are entered through the nav bar, you can actually pull them in. Let's say that mom or dad has a history of diabetes. I can click the plus sign in this family column, and then as long as I have added a family member through that client's record, I can pull them in to this and have a record of that. If there was an age of mortality, you could add that. But then that would add kind of a family record of that particular condition. At the very bottom, you have some extra text boxes to describe those specific types of cancer, autism, or diabetes if needed. Just a couple extra notes about the medical profile before we really hop into the next section of information here. As always, you'll want to click Save. What's really, really important here, okay, key point to take away with the med profile, 2 key points to take away from the med profile as I'm thinking about them. Number 1 is if the client is under 18 and you're prescribing to that client, you must have a height and weight entered here in this medical profile. It is an absolute requirement to have that for prescribing, e-prescribing to clients under the age of 18. Second thing to know about to take away from this. Next time that you're adding to the medical profile, next visit, we're adding a new page. Okay, think about it like a book, like a file, like a record. I'm adding a new page to the medical record. So I have to click this Start New Profile button at the very bottom. Very important step, or then I begin to overwrite the old profile. So this is our next visit. We'll do our height and weight measurements again. Oops, 5'11". Maybe our guy Chris has lost some weight now. He's down to 173. Check-in notes, great. But what you'll notice is that these larger items like our vision, hearing, mobility, the med conditions, they stick. They stay from profile to profile unless you change them. But those other things like last hospitalization, general state of health, check-in notes, height, weight, those will be fresh for you each time that you create a new profile. Then of course, once I'm done with my med check-in here, I'll want to save that one. And you do have a history of all of those running profiles if you click the history button here. So what questions do you have about the med profile? Okay. Let's hop in then to the orders tab here, or the orders link on the nav bar. There is a medications link. I just want you to be aware of that. But because you guys are using orders, best practice is then for all medication related information to be captured through the orders link. So even if you're just documenting a med, you can do that. So what we're going to do here, we're going to document a med, we're going to actually prescribe a med, and we're going to create an order from here. So three separate things. Not everybody is going to have access to orders. So if your profile code is not allowing you to do so, please just follow along and take some great notes. If you do have access to orders and creating prescriptions and all of that, then awesome, you can click along with me. But we are again in the orders link on the nav bar. You'll see once you click there, you get an overview of the profile. So you get some very basic demographic information. If you have a picture on file, it'll show up. Med profiles there, allergies, warnings, anything that has been entered in those fields will populate here. Nothing yet, okay, we haven't added, or I haven't added to Chris's med list or his orders. So nothing's populating down below. But like I mentioned, we are going to just document a medication first. So Chris, let's say, came to us from a different agency, an external provider, prescribed him something, and he's bringing it to us, and we're documenting it now. Under the More Actions tab, there's the Add Medication button. It's going to take me to this screen here where I have the ability to add a medication. The medication text box at the very top of the screen is a search as you type field. So let's say Chris came to us with a prescription for Ativan. I can start to type. And as I start to type, I'll get all of the options that are related to what I've typed so far. Just like when we added the allergy, it's very important that I select from this list in order for the med allergy interaction check to happen. So let me actually show you what happens if I try to record something or try to prescribe something with an allergy interaction. So I typed in penicillin as an allergy. So if I try to prescribe him or record any kind of penicillin, when I click on that, the system now is going to give us that allergy interaction. I could override it, not suggested, but I'm going to go ahead and clear that out. I just wanted you to see that pop up. So I'm going to go back to Ativan. He again is bringing this to the table. I'll select from there, and then you're just recording. In this instance, you're just recording what this prescription is, what he's kind of presenting to you. So let's say the action is take. You can choose if you're following along with me, whatever it might be. I'm going to say, let's say, nope, it's one. Take one tablet. You have all kinds of dosage options here to choose from, all kinds of different route options to choose from. I'm going to choose oral route. And I'm going to say frequency is twice or 2 times per day. The instructions, of course, are there for you to fill out once in the morning and once in the evening. Take with food. I don't know, whatever instructions might be needed there. You do have a rationale box in order if you needed to record that. Is prescription is just a For recording purposes, this isn't actually creating a prescription. This is just documenting that it is actually a prescription. And then this provider dropdown here is a list of your internal providers. Those are in green. But there's also those external providers that we added through the external provider link in the client's record. So Michael maybe is the guy that Chris was seeing previously. So I'll tie Michael to this prescription. And then you'll just record what quantity is being presented to you at this time. You could enter refills. I'm just going to generally put CVS there as the pharmacy. And you have the date here of when it was started. So maybe this was started back in March for Chris. When you're ready, you'll click that add medication button. And what that does is adds it to this list here, both in the orders and in the current medications list. Oops, when you click that, it disappears. My bad. Concurrent here, meaning that it was prescribed by an outside and external provider. If that said current in there, that would mean that it is from an internal provider. Any questions about the capturing of a medication? Okay. Well, then let's go through creating a prescription. Most of us won't have this right, so this is probably a good chance for a lot of you to just follow along. But we're going to do this through the orders link again on the client's navbar. There is this create prescription button right away. Constance asked if there was an easier way to do this or do through a note when doing an initial evaluation. Let me show you. Yeah, let me show you that. There's a thing called the client intake link. I will show you that client intake link and what that provides access to in just a little bit. We will still want it to be documented though through the orders, but we can access that in a different way. Different people in the training might be accessing it in two different ways, so that's why, Constance, I'm showing it here first, and then we'll look at it in the other way. Okay. Creating a prescription, though, again, we're looking up here in the upper right-hand corner. I could search for that medication. I know he's already on Ativan, so it probably doesn't make sense to also prescribe Zoloft. I just know that I can in the system, so I'm going to choose it. Doesn't make medical sense, I apologize, but just for demo, it's a search as you type field. So as you type, you'll be presented with the different options of medications based on what you typed. You can also see that the generic equivalent will populate to the right-hand side. It'll also populate below, but on both sides, however you would like to choose that. So you'll again click on the medication that you are about to prescribe. If you are somebody who maybe has the ability to kind of set up the prescription, write the prescription, so maybe you're a nurse or an aide, somebody who has non-SPI prescribing rights, you might be able to get to a point where you can do this and select the provider that it's going to, that you're writing it for, and then the provider then can actually finish out the prescription later. If you are one of those people, you'll see a drop down here where you could select the provider that you're setting this prescription up for. If you are a provider and marked as a provider, you will just auto-populate here. So I am marked as a provider, so I just automatically populate here. There is a save option. So if this is a medication that you frequently prescribe, you could check that box. And so that way you won't have to search for it. When you go to that med list, you'll have a list there of your kind of favorite meds that you prescribe frequently. I always hate to call it favorite meds. I think that's a weird term, but it makes sense if you do it frequently. As you continue down the page, a lot of the medications will have a recommended dosage that if I click this link will automatically fill out my SIG builder. I don't have to click this, and if there is no recommended dosage, I can obviously fill out the SIG builder manually and open up these drop downs and select and enter information as needed. There is this show all choices option. So if I'm not seeing something, if I'm filling this out manually and I needed a different action here, I could check that box to show me all of the choices that might not have been populating. And I can fill that out. I am going to show you though how quick it can be. If the recommended dosage is appropriate for you or for your client, you can do that. Just click the link and it automatically fills in the SIG builder. Take 2 tablets by oral route 1 time per day. You could add extra instructions to go along with that prescription. Note that you have this free text option as well. If you wanted to, if you preferred to free text, just know that only one of them will be sent. When I click send to pharmacy, whichever option I'm on here, and this is what this little red warning is here. If I'm on SIG builder, when I click send to pharmacy, that's what's going to send, whatever's in SIG. If I'm on free text, when I click send to pharmacy, whatever I have typed so far is going to be sent to the pharmacy. So just, we always say that to be careful, because if you happen to start free texting but really wanted the SIG builder and forgot to go back and only typed half of what you needed, it could, you could feasibly be sending kind of a halfway prescription. So just know that whatever you're left with, whatever's selected, is what's going to send out. You have monograph information here, contraindications. If there were any med allergies, there would be an extra little tab here, and you'd be able to check that med allergy or any allergy interaction that might be happening. I can enter a quantity. What is that? These are tablets, 30 tablets. How many refills are there? You can enter day supply if you didn't want to put the quantity, whatever that might be. And then you also have the ability to save this as a template. So let's say you weren't using the recommended dosage. Maybe this was a manual entry, but it's a manual entry that you use frequently. You could save that as a template, so that way you won't have to do that every time. And just like the recommended dosage, you could click that template and it will populate to save some time. These additional comments aren't actually on the prescription. These are comments for the pharmacy. They're not actually going to be listed on the med itself. They're just additional comments that might need to go to the pharmacy. And then you do have one more option here, one last time to choose or to use the generic if needed. At this point, I'll click Send to Pharmacy. And this is where I can begin to choose my pharmacy. So in our training domains, there's like, they pre-populate with some random recent pharmacies or random local pharmacies. Technically, this list will be your favorite list, but in the training domain, it just kind of chooses some random ones to show up here. But if you favorite or assign a primary for a client, that's really what's going to populate here. The training domain just is choosing some random ones for us right now. But if you're searching for a pharmacy initially for this client, you could search for that pharmacy by name, by city. What's your zip code up there in DC? Someone.
20011.
Okay, so I could search by zip within so many miles. So let's just do that. Different options to select here. But I'll search for a pharmacy within 5 miles of your zip code. All those options apply or filter in here. If I'm ready to select it, I'll of course click the select button. Just know these two buttons here can be helpful. Favorite column is for the prescriber. This will add the pharmacy as a favorite of you. The prescriber. That way you'll have quicker access on that previous screen. The client primary is exactly that. If this is the client's primary pharmacy, we can assign that. Unfortunately, this is the only place where you have that, so you will have to go through this to this point initially in the first time you prescribe for that client, but then every subsequent time you prescribe, they'll show up. That favorite or that client primary will show up for them the next and subsequent time you prescribe to them. I'm not going to do that now though. I'll just go ahead and select Columbia Heights. And this is the final kind of review screen here where I can double check everything, demographic information, provider. This is our fake provider address, the actual prescribed med. Double checking that, I have the ability to go back and edit if I need to, if I'm reviewing and realize I made some mistakes possibly. Again, these additional notes are notes for the pharmacy, notes to the pharmacy. If you have different clinic locations, you could select those here. We can associate with this as long as the diagnosis has been entered into the client's nav bar or into the client's record. We could change the pharmacy if we need to. And I did say this was the last time, but if needed, we could allow substitutions here, or if it absolutely had to be dispensed as written, I could choose that option here. And then you have multiple options. Send is going to do exactly what it says. Send and print will also do exactly what it says. If you needed to print a physical copy with the electronic sending of it, you could do that. Approve without completing is the button that some of us might have as kind of non-SPI providers. If I'm setting this up, I could approve it, and then the actual provider could come in and be the one to send it out. Or even if I am the provider, maybe I'm just not ready to send it yet, I could approve it before it gets, and then just send it out at a later time. But I will go ahead and click send. I'm going to get an error, and anytime you're in the training domain, if you have prescribing rights, if you're practicing in the training domain, you will always get this error, which is good because we don't actually want to send anything to any pharmacy yet. So it will say that it's been rejected. And that's when it will get added after we send it. In the actual domain, this will become a current status. When it's ready to be refilled, you'll have a refill option here. You'll also have a discontinue option in your live domain as well. So that shows up both in the orders and in the current medications list down here. What questions do you have about that prescribing piece? Okay. Wonderful. Let's excuse me. Let's then create an order. Actually, let me ask Patrice, do you have any orders right now that are you doing dietary orders, ordering labs, anything like that?
They would definitely ordering labs. We're setting up our eLab module now.
Okay.
We have dietary orders for places like medical respite. Yeah, so we have a lot of the things that are there, yes.
All right, just wanted to double check it there. So then let's go back first because I did a step without talking about it. Pretty straightforward though, there is the create order button. Thank you as well, Patrice. There's the create order button in the upper right. This takes me to my create order screen. You can see the different options here. I think there probably is a little bit of configuration that's still that might be happening in the background with this. But if I select dietary, depending on the type of order I select, will dictate some of what I see below. So because I chose dietary, now I can select these dietary options. But maybe it's low sodium and vegetarian. So anything I select here will show up. If there is an other option, I could add that here. You have options to select for severity. Is it now, stat, normal? You have a box for the reasoning. Those that required, we could enter that. What's the source? Did it come from phone, verbal? Did it come directly from the physician? What's the order time? It's automatically going to timestamp now, but if I need to change that, I could with my calendar or clock icons or type in there. If I need to relate this to an episode, I of course did not assign him to the I did, the respite program. So if I want to relate this to the DC respite program or episode, I can pull that in. Who's the physician? If it's not you, if you're not the one, you could choose the physician here. If we've entered external care providers, we could, if it relates to anything with your external care providers. And if you needed to just have a secondary employee on this, maybe it's somebody who will complete this order. Maybe the physician's the one who's signing it, but somebody else will complete the order. You could add that person here. And then they'll also, this will be added to their orders so that they have it on their list as well. Due date is here if you need to use it. It's internal, I'll check that box. And then you do have the ability to set this up as a recurrence. Okay, that create buttons up there. Daily, every 1 day, and then we can, there's no end date, maybe, or maybe you could, if you wanted to end date it, if you knew he was only going to be in respite for 3 days, 5 days, you could end it after that many occurrences. or that many days. Let's say he's only going to be here till Friday. I could end it then. Okay, so you'll double check your order. And again, depending on the type of order, you'll have different options here, and you can always go back and create different orders. But once you have that, back at the top is the create button. And that's what will actually create that order. That'll get added to the orders list. If you were ordering any kind of med, it would show up in the med list, but we didn't do that. So no meds got added. We just got an order that was added. You can view that order. It is recurring. You could add notes to this if you needed to, just for documenting. The actual order information is listed here. All that we entered is here. If you're the person who needs to sign this order, so you will see that, or you should see that in your pending orders. But this is where you could come in and sign it. For those of you that do need to sign, you can sign multiple at a time if you need. And then if you're the person who's coming in to complete that order, there is the complete button here, and you can access it through your client navbar, or if you got added as an employee like Patrice, you should see that in your orders through your employee navbar. But if I'm the person completing this, I could click the complete button. All that order information is here. I'll put in my time of when I started it, when I finished it if I needed to, what was the outcome. The outcomes will be different based on the order. Maybe let's say he consumed his entire meal. I could add an additional order from here if I needed to. I could just save it if I needed to come back in and update it later, or if it's fully complete, I can complete this order. And then because I completed this one for today, it auto-populated tomorrow's in here because we set it up as a recurrence. What questions do you have about orders?
I have a question.
Yeah.
Is this where if a nurse administers any of those meds that they would be signed off on?
I'm just thinking about the different ways that you have to go about that. Patrice, I might need to pull you into this.
Okay.
Actually, sorry, I had to think through that question for just a second. Who asked that? I didn't get to see who that was.
Sorry, Hannah.
Hey, Hannah.
I'm a nurse, so that's why I'm wondering.
And are you in the respite program?
No.
Okay, so there's a couple different options for that. If we're administering meds though, typically that's going to happen through the EMR. So for your more residential programs, that's going to happen through EMR, which we're about to see.
Oh, okay then.
If that's, I guess I just don't fully know your workflow, and that's why, Patrice, I wanted to pull you in, because I don't know if there's any time where there would be a med ordered for somebody that wouldn't go through EMR. Does that make sense?
I am actually going to defer to Dr. Flanagan for the workflow for that part, because I'm not sure.
Okay.
So would Elizabeth or Dr.
know-
Flanagan?
I know for Dr. B, and I know for Lucy, for some of our clients that get injections, sometimes we've had to administer Benadryl. And I know that we did have a client, but it was a what would we call it? Like a one-time thing. The client was agitated and Dr. B did give that person a med. So I guess we would need to talk through internally how we would handle those. You agree, Dr. Flanagan?
Dr. Flanagan, you were muted on this end. I apologize. I did just see your message in there. So you should be able to unmute yourself, but there you go. Oh, it might still not be working. I see that you're unmuted, but I can't hear you. Yeah, you're good with the questions box though. So I did see that Dr. Flanagan said that yes, you're right. So that is a little more. Yeah, Dr. Flanagan, sometimes we all have mic issues, technology issues, I understand. If you need to input anything in here, just let me know. Or just throw it in the questions box and I'll make sure I read it out. So it could feasibly, in terms of functionality, let me speak to it in that form. If there was an order put in for an injection for a med like that, it could be signed off here. If it's something like in the respite program where it's more residential, we could do that through EMR, right? The other thing too is that in that primary care, so if you're looking at my screen here, what's his name? Rhodes. In that primary care, you have all of these kind of injections and all of these things here that you could put through the scheduler. That as the individual who's doing that or completing that injection would and could do that. So we'll look at that in just a second as well. I know we're coming up close to time here, so I want to definitely get into EMR. And again, EMR is on the client's nav bar. EMR really is more for those residential programs, and you do have to have medications already on file or in the client's record for the EMR to work. So nothing's shown up here because I didn't create a schedule for them. But I can edit. I clicked EMR on the nav bar. I'll click this edit button in the upper right hand corner. And in order to do that, I have to click one more time. I have to create an EMR schedule. So I can pull in any medication that I have added to this client's record. So I'll choose my Ativan that I added. Everything pulls in from what we had before, or from what we entered initially when we added this medication to the record. If I didn't enter anything on that or as much on the screen, I could enter it manually, or I could adjust it if I need to, if it differs for this EMR schedule. I'm going to keep it as is just for time's sake. You guys don't have any EMR visits attached to that. We always like to suggest that this use counts option does get used because it will auto track all of your pill counts. So if I know I have 30 pills initially, then I could select all these to show up with it when I go to administer, show the total quantity taken, track unused. So if there was maybe one that got dropped or broken or spit back out or something, you can't use it, we can track those and we can document the reasoning for it. And then we'll want to auto track so that we don't have to manually do those numbers, just saving some time. This is where we could do the recurrence and set that recurrence up. And this is why I say EMR is really more for those more residential programs, because this is typically, we need to set up a schedule for it. So maybe this client takes it once in the morning every day, or once in the morning, once in the evening. I could set that up. Or if it's a PRN, if it's an as needed, I could do that as well. It will set it up as an as needed med, and you could administer that within a time frame or at any time, but set it up to have a max number of occurrences. Let me set this up though as a daily. He's taking this Ativan twice a day, right? Yep, 2 times per day. So we'll do every 1 day. And you could do it every so many hours. You could use a preset schedule. You guys don't have any configured in here yet, but you could use defined schedules like morning, evening, 8 a.m., 8 p.m., 8 p.m., whatever, however you would want to define those schedules, or you could enter it manually. So I'm going to do that. I'm going to take tablet 1 at 9 o'clock. Okay, I have to be a little more specific in this one, 9:30 a.m. And as soon as you enter the first one, it'll auto-populate the second one. If you don't need the second one, you don't have to enter anything. That's okay. And let's say that we take the second one at, I know this is going to be weird time frames, but I want it to show up so I can actually administer it. Obviously, you'd want that to be an accurate time. And then you do have to put an end by or an end after. So maybe he's only here for a week. I'll put it out for a week. And if you wanted notifications for the end of this recurrence, you could check that box. We always suggest to generate the preview, because if you missed something here, it won't generate the preview for you. Plus, it is just nice to see, okay, this is what it would look like. Start date, end date, admin time here, check, 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 good. So that I can actually create that schedule. So now I have a schedule created for a med that I added to the client's record. So now, and I missed a step. Oh man, I'm so sorry. And now, when I click into the EMR, this is where I have the ability to come in and actually administer this this medication. Okay, anything that was previously, these dates, we didn't actually have this EMR schedule set up. So you see the dash, the RX is your future administration. I have to go in and edit this because I need to open up that window. So let me edit this real quick. Actually, it's a good point. I totally skipped right over this and I apologize, but you have this admin window as well. So it's set to only 1 hour. So that, you saw that it's only 11:49. So once 12 o'clock hits, that admin button would show up because it's set to administer at 1 o'clock. But if I open that up to 2 hours, I could go all the way up to 24 hours of an admin window. It means I have 2 hours before and 2 hours after the actual admin time that I set up here. So now when I save this, and I'm actually going to take this back a day so that you can see more. Let me update that. Now when I return to EMR, this is what I was looking for. So I apologize for those couple extra steps there, but now that I opened up that admin window, you could see a couple other things here. If you missed an administration, it'll show that. Keep in mind that only specific profile codes with the specific rights will be able to administer or go back in and edit missed meds. But then when it is time to administer this med, I can click admin. All those, the med itself shows up. All those instructions show up. Everything we entered through that EMR schedule is populated here. We have these results. Was taken. Let's say one was administered successfully because we're taking one right now. Unused meds, so maybe we tried to administer one, fumbled it, and it got stepped on, destroyed, and that will all then auto track because we set it, we configured it to auto track down here. So we started with 30, took one successfully, dropped one, so now we have 28 left. You can add notes here needed. You have that total from the last 24 hours here as well. So then I'll save that. The status, if it was taken, however you statused it, will show up with your initials as the person who administered it. Any questions, or what questions do you have about EMR? We're good? Promise?
I think so.
All right. Sorry, that was a lot. So I wanted to really give you a good wait time and make sure that everything was good there. So let's look at some documentation then, guys. I tried to go as quick as I could with the top half stuff. I might, if you have the ability, I might need to ask for maybe like 15 extra minutes from you. If you have the ability to do so, just to make sure we get through everything. But we will hop right into the schedule and take a look at what this looks like through the schedule. So I have an appointment on here that I had previously scheduled. I think for most of you, your appointments are probably going to be previously scheduled. But if I needed to schedule something, it's just a matter of clicking, or even if it's not in the future and I want to document through the scheduler, it's just a matter of clicking in the gray space, the gray grid on the day and across from the time that you're entering something. That pulls up your scheduler window. You could search for your client. You could search for your service type. Remember, you have the different program codes on the left-hand side. So just be careful because some of those services cross different programs. So make sure that you're choosing the correct program. You have the Maryland, the primary care, you have all of these injections that are in here, home injection, blood draw. This is not every program, so of course you'll be able to come in and experiment with that. DC Mat, you have, there was one that I wanted to schedule. I wanted to see for you guys for that. It was Mat administration. So I'm going to schedule that one. I could, of course, click begin service if I'm doing this right now and I just want to document it right now. I can click begin service and it will take me directly into the service. Keep in mind too that I could check warnings up here and I could check authorization information up here. I'm going to schedule that just so we can come into that one. Excuse me. What I have here, if I have a previously scheduled appointment, I can click on to that link, and then I can click begin service. So this is an E&M new patient for the Maryland primary care program, I believe. So I'm not going to go through every one of these. You guys have the training domain, so you have the ability to come in and actually vet every one of these categories of this form. This is a pretty extensive one, which is great. But I do want to point out a couple of things. Constance, you asked, is there an easier way? So yes, maybe I am a physician who is in an assessment such as this. I have, at least in this one, I have physician's orders as a link that takes me directly to orders, where I could do all of those things that I just did while I'm still in the actual service. I have not left this service. I could create an order, I could create a prescription right here. I also have the client intake link, which basically does the same thing but gives me more options across the top. I could enter a diagnosis through here. I could resequence them through here. I could add allergies through here. I could update the med profile. You could always hover to discover to find these things. Yeah, orders isn't there. So the orders would have to happen through the actual orders link. But if you needed anything else, like I said, like the diagnosis, insurance info, all of that, while you're in a service, the client intake link is great for you. The client intake link is typically active in most services. The physician's orders might not be active in every single one, so you'll just have to play around with that. But Constance, does that, or Dr. Flanagan, does that kind of answer your question from earlier about there being maybe an easier way to access those? Perfect. Okay. So let's return to this documentation then. As I'm looking at this, just know that documentation is completed the same way, whether it's this new patient, E&M, whether it's an injection, whether it is an individual therapy session, it all is going to be laid out like this with the client's name in the upper left-hand corner. If you have multiple forms that you're completing, they'll show up here. I could pull in an additional form. So let's say I'm going through this visit and I need to pull in a different vaccine or different injection or a contact note. You have different options here in this drop down to be able to pull in multiple services at one time. So I'm just going to pull in I'm going to pull in a blood draw and add that form to this. Okay. So now I have both of those here, and I can go to that blood draw. As you then look further down, this billing info takes you directly to the sign and submit page. Incomplete view allows you to just view all of your documentation. If you've entered, it pulls together all the categories and you can kind of vet it before you go and sign and submit that. And I showed you those bottom two. So then once you're ready, you could use either the link tree or the buttons to go into documentation. I prefer the buttons. And then this is where you guys have the ability to go in and really vet this. I'm just going to show you some functionality of the forms. You guys can of course come in and really go through and check out the wording and the what you have available. But know that there are check boxes that open up extra text boxes You can add extra space if needed. And we're at 12:01. If anybody really has to hop off, I totally understand. And I apologize for going over a little bit here today. But if you can give me an extra 15 minutes, I will be able to wrap this documentation piece up in about 15. This is a great example of injected information. So your vital signs have pulled in. So what we entered in the medical profile is being injected into this form. Vitals here can be entered. And then you can document, again, with this checkbox opening up an extra text box. Right. With all of these different categories, you'll always want to click complete. And when you click complete, you'll get a little green check mark. That tells me that I saved my work. Doesn't necessarily tell me that I filled out every single question, but it will let me know that I saved whatever I have done in there so far. Some of these categories might have required questions in them, and you'll see a little asterisk next to it. And if you go into one of those categories and you don't complete one of those required fields, you will get a pop-up telling you you have to. Let me ask you though, just for time's sake, I'd love to go through one more category together. What would you like to look at? Somebody let me know which category on here you want to go through. We'll do it together. No preference? Oh, Patrice.
Let's see. Which one would you suggest? Which one is the most fun one?
Let's look at this one, the diagnosis and plan of care.
Perfect choice.
Yeah. So diagnoses can be injected. So this is another great example of injected information. What you do need to know is that this injected info kind of injects in a bulk format. So that's why this box is up here. What's nice though is that I can just copy and paste this diagnosis. So it's being injected from what we entered. So I can just highlight that, copy, and paste that down here so I don't have to retype the whole thing. So it's being injected at the top in a bulk format. I could take my second diagnosis, throw it down here. Then I can enter my plan of care for diagnosis 1 here. Plan of care. Here, right? If you have multiple up through 5, you could do all of that. Big helpful hint up here, I pointed out the intake link already, but this is a nice reminder that if you need to add a new chronic problem, a new diagnosis, excuse me, you can click on that intake link and add it there. I will also just let you know that if you already entered something here, you'll want to make sure that you click that complete button so that you save whatever you entered so far. And then I could go to that client intake link. Let's add a new diagnosis, click the little stethoscope. I'll start a new one. Let's say upper respiratory infection. Sure. I don't know. I have kind of like a cough and congestion right now, so I'm kind of thinking about that. But let's say we needed to add a new issue. We'll save it, whatever that might be, whether it's medical or behavioral. Now that I added that to the intake link, if I go back to diagnosis and plan of care, you should see injected here. Oh no. Interesting. Of course that didn't work for me. That diagnosis didn't pull in. Let me add another. We'll save that one. Huh. Because I don't know why that didn't work for you, but it should. Of course, when I want to demo something, it didn't work for me. When I update in here, it should inject immediately into your field. So that is a note, Patrice, I would note that. I'm going to note it myself too and bring that to Fatmata to see why that wouldn't have injected immediately.
Okay.
Because it should. But you could, again, update that and it should pull in immediately there, but we'll check on why that happened. Okay. Just quickly, again, you have all of these other categories to open: current medications, inject, okay, review of systems. You have radio buttons. Sometimes our radio buttons will open up text boxes for you to be able to enter information in. And again, you guys will review all these as you get back into the practice or into your domain. Physical exam, lots of check boxes for that. Risk evaluations. Okay, so you have some categories within a category. PHQ-9. This is a great example. You can just check your boxes. I don't think this isn't fully configured yet, but this will, in your production domain, calculate automatically for you with that number, and then you could select your guide here. Immunizations, all listed all the way down through here. Okay, procedures, all it is there. I just wanted to take a quick glance at those for you, but big takeaway here is that once you are done with your service, the location, you get to your sign and submit page. Location pulls in from when it was scheduled, if a location was entered when it was scheduled. If a location wasn't entered when you scheduled it, you will need to select one. It is required. If it changes from like home to telehealth, you can do that on this screen. Diagnoses can be pulled in and reordered here as well. We talked about, I showed this briefly before, but if for this visit I needed a different diagnosis to be primary to go out for billing, I could. If I need to add a secondary one, I could do that. Recipient typically auto-populates. If you need to select your E&M level here, you can. Billing groups can auto-populate as well, but if you don't, just make sure, we noted this yesterday, make sure that we know from team to team, program to program, and employee to employee, which billing group needs to be selected if they are not auto-populating. Big point here, these are your time, your actual times. So for documentation purposes, for billing purposes, we'll want to make sure if it's a previously scheduled appointment, it will just put the block time that was scheduled, but I can adjust that. So maybe it went from 7 a.m. to 7:53 or 7:52, oops. I can do that. Just be careful that if it's a PM time, that you note that as a PM time. If you're good with military time, you can do, I'm not, so I don't know what segment is. What is that, 19? Yeah, okay. Military time works there as well. The password is the password that you use to sign into the domain. Then you have a couple different things. I have the sign and submit that does exactly what it says. I have this save billing info, which is nice. So maybe I got to maybe I finished the appointment with a client and I want to document my end time so I don't forget. So I could come to billing info, pull in, all the pertinent billing info, including my end time. Then I could just click this button and it will save it. So I don't have to remember the end time, but maybe I don't have time to finish all the documentation in that moment, but I save my end time. I could come back and finish documentation later. There is also the discard service button. Discard service is if you don't need this, if you scheduled the wrong one or you pulled in maybe this blood draw and you don't need it, you'll want to go to the sign and submit page and discard it so it doesn't become an incomplete service. As long as you've saved your employee signature, like we mentioned earlier, it will automatically pull in, but you do have these other signature boxes to capture those signatures as needed. So then when you're ready, you could go ahead and sign and submit. Because I pulled in another form, I'm not automatically redirected to the service tab. Typically, if you're just doing an individual service, you will always get redirected to the service tab. But when you pull in multiple forms or you're doing a group session, you won't be redirected. So I'm actually just going to discard this because we don't need that one right now. I do want to take the time to take a look at this Mat admin. So let's go into that just real quick. This is actually just a progress note right now. Is there anything that you want to see real quick? Any other, as you're looking at the service list or service type, is there anything that you wanted to just glance through real quick together?
I have a question. So we do a lot of blood draws at Greenbelt, and I don't really like the options that are available for documenting once I begin the service. Like I would like to be able to do some type of progress note. Is that something that we can change?
Blood draw, using this one.
Like none of those really apply.
The short answer is yes,
Okay.
but that's going to have to go through project team, and that's going to have to go through a change request then through Credible.
Okay.
If they haven't already altered this. So again, short answer is, of course, these forms can be edited and changed to meet your needs, but in terms of exactly what you need and how that process might look is going to be dependent upon where they are in the implementation process with that. So Patrice, did you make a note of that?
I did just make a note.
Who was that was speaking?
Oh,
Hannah?
sorry, this is Hannah.
Anna. Yeah, so I can't ever see, like, unless I have the window open, I can't really see who is. So thanks, Hannah, I appreciate that. Cool. There were a couple questions that came in. Dr. Flanagan, I also noticed the medication tab, wondered what the difference was. Yeah, so technically, Dr. Flanagan, you can add through the med tab. We have been instructed to tell you that if you go through orders, or if you're using orders, that everything should go through the orders tab. To be honest, I never asked the question why, and I should have. It was just kind of a blanket statement that was made that if you're using orders, it should all go through orders. So let me check on the why of that, and I'll get back to you because you are correct that you could still add through meds, but you are using orders. So let me get back to that. Dr. Flanagan also asked if there is a note or if notes copy forward to the next note. They do not. They do not. However, what's nice is that we can open in multiple tabs. So if I needed to view a previous note for a client, I could open up this client list. I could go to my client here, and in this service list on their nav bar will be all of their previous documentation. So I could search for the particular service type I'm looking for. If it was completed by me, I could search for that, and then I could click into the ID and pull that up. Then, of course, if there's anything I needed to just copy and paste over to the new note, copy into that new note. So that's the answer to that question. And then you also, Dr. Flanagan, wanted to look just quickly here at a psychiatric note. What program is that in? Is there a particular program that you're looking at for that, Dr. Flanagan? MD LMHC. Okay, we don't have a particular, is there supposed to be a, Patrice, is there a particular psychiatric note compared to just an individual?
We haven't created that yet. It's going to be submitted for a change request. So that's not there yet.
So Dr. Flanagan,
But if Dr. Flanagan wanted to send me a note that would be the perfect note for it, then when we're submitting the change request, we can make any changes that she has always wanted to see.
she said, yes, please, Miss Patrice, thank you.
So just email me your wish list.
I will, just for everybody, let me just show you just our kind of our basic progress note that it'll probably be based off of. There's just kind of some session information here. Modality, who was present, issues reported, check boxes, risk assessment in here. So this is probably what it'll be kind of based off of. So if Dr. Flanagan, you wanted to just look at maybe an individual therapy and see what that looked like, and then you have your different types of progress notes, SERP, DARP. And I have seen these SERP notes, these DARP notes adjusted to so many different agencies use different acronyms all the time, and they just adjust those to reflect what they need. So, okay. I said 15 guys, and we're at 19, so I definitely don't want to hold you up any longer. Let me cover one thing with you. In this question mark, there is the question mark takes you to the knowledge base. Sorry, my mind went totally blank there. Question mark takes you to the knowledge base. Question mark is in any domain. Knowledge base is super helpful. If I click that magnifying glass, it's my search. Maybe I'm looking for EMR information. I can find all articles related to EMR. Sometimes you don't get much, but there are so many other also reads that you can find. And then what it also does is opens up the reference library. So if you're not finding quite what you're looking for, you can kind of go to the reference library and find more maybe of what you're looking for. So knowledge base, just like searching in a database, what I want to point out are a couple things here in the LMS. The LMS is a separate website. I always suggest to bookmark it. And once you have access to this, you might enroll in trainings yourself. You might have other people enroll in trainings for you. You'll see those show up in the My Training. I want to point this one out. Make note of this, screenshot it, write it down, take a picture of it, whatever you need, because for our prescribers, this is really, really fantastic. I know we don't always like learning through videos. I know I personally don't, but this is one that has been created that is a great click along. It shows some information and shows some demonstrations that we can't do in training domains. They got some special privileges to be able to go through real-time eligibility, to go through the renewal process that we can't typically do in a training domain. The PDMP, all of that stuff is fully demoed in this. So make a good note of that one. The other thing I want to point out here too in the catalog that we just started creating under the Credible Partner Training folder, there's this micro learning series. And it's just little bite-sized pieces, 2 minutes to 8 minutes or so about all this. So what's great is that you guys are using orders. So adding a med, creating an order, creating a prescription, all that stuff we went through is split off here into a nice bite-sized piece for you. We're slowly adding to that. It's hopefully going to be every little bit of functionality down the road, but right now this is what we have in there. So guys, if there is anything else that I can help you out with, you're going to have a follow-up call. But I would also like to extend, because we didn't, I felt kind of rushed, and I don't know if there was maybe anything that I missed. If there's anything that I can help you out with, if I can maybe steer you in the right direction about, or if you have any lingering questions about anything that that you find, please don't hesitate to reach out. I'm not going to leave you in the dark. I want to make sure that you have the info that you need. So please, please reach out at any point with any questions that you might have. But otherwise, I don't want to hold you up any longer. So you are free to go. Just remember that survey is linked in your training domain, and I'd appreciate it if you could find the time to do that. Otherwise, guys, have a great day.
Can I ask a quick question? I don't want to keep people on. This is just for me.
Sure. Yeah. If you are free to go, or if you're good to go, feel free. But Hannah, I'm here for you.
Thank you. So just going back to the medical conditions.
Yep.
So adding a medical condition. Sorry, where'd it go?
Profile.
Medical profile. If I'm trying to add something for a family member, it looks like I can only choose a family member that I've already put into the system.
Correct.
Okay, so if they say like, oh, my great grandfather had this, I have to, because when I'm selecting add family member, it's saying it won't let me create a new one from here.
Correct. Yeah, you can only create that family member through the family member link here.
Okay.
On the nav bar. Yep.
All right, just wanted to check. Thank you.
Yeah, you're welcome.
And then, oh, for some reason, when I'm doing a schedule and say like for a no-show, and I click on the begin the cancellation note, it doesn't take me to the cancellation note. It just takes me to the regular old
like the progress note?
appointment note. Yeah.
Interesting. Yeah, because I practiced with that yesterday, and it, sometimes if it's an older appointment, let me do this, just see what happens. Of course he's not. Oh, yeah,
Oh, okay, maybe you have to do a new one or something.
Did you already begin the service? Like, was it an incomplete service you went into?
I don't think so. I'll just add something else real quick.
Yeah, that's the only thing I can kind of figure out here, that when I go into this incomplete service, even if I change the status, it's still going to take me to the service that I already started, whatever that schedule. Does that make sense? But if I haven't actually begun the service yet, and I change it to that no-show and go to the cancellation, it'll give us that.
All right, let me just say no show. Yep, okay, so if I ever catch that glitch, I'll just redo the schedule. Okay.
Yeah, that is a good point, because if you, well, typically I would say, I mean, if somebody already began the service, then they shouldn't have to theoretically be going back to cancel it, right? Because if they click unless they click begin service accidentally. You see what I'm saying?
Yeah, okay, I got you.
Feasibly, that should just be discarded if they didn't need it anymore, or it should really be completed if they already clicked begin, so that it goes out for approval and billing.
Okay.
So that's probably why the system, I'm just kind of conjecturing, that's probably why the system takes you to whatever
that makes sense.
once it begins. So okay. Anything else? Any other questions that popped up there?
No, I think that's it. Thank you. I really appreciate it.
Yeah, of course. You're very welcome. So I might see some of you guys again at 2. I would say, I'm just gonna, if any of you are here and lingering, those of you that are coming back at 2, just so you know, what's happening is that we're going to do more with this scheduling, all this. So if you already saw this, and Patrice, I don't want to step on your toes, but if anybody saw all of this already, the only thing different is maybe the treatment plan for our clinicians this afternoon. So I just wanted to put that in your ear. So if anybody has already gone to like 3 sessions or so, they've pretty much gotten everything.
Mm-hmm.
So I just wanted to let you know that.
Okay.
Okay. All right, guys, I'm gonna go ahead and end this, and I'll see some of you at 2 o'clock.
Thank you. See you soon.